and position, sir?
I am Alassane Bakar Kamara, the Program Manager at Hfac Coalition.
Okay. So, why really the night monitoring?
Basically, the essence why we are conducting the night monitoring is for us to support the Ministry of Health and Sanitation and development partners to ensure that our facilities, most especially our hospitals, are safe by the provision of drugs at night, the availability of staff at all times, infrastructures, electricity, and to ensure compliance to the medical ethics code of conduct. That means staff must be diligent in providing the service. They must be on duty at all times, and they must provide the service required of them.
Okay. So, what do you want to achieve?
Basically, what we want to achieve is basically very simple. It's boiled down to the safety of the clinic. We want to ensure and complement the effort of the ministry in making sure that our hospitals are safe at all times, not only during the day, but they are also safe at night. And when we say safe, it basically means all the services, starting from drugs, are there available, and the people get the drugs. Electricity is available, infrastructure, toilet facilities. So all these are the necessary things that should be in the facility to make the facility very, very safe, including staff.
Okay. And what are your monitoring strategies?
Our monitoring strategies basically focusing on 8 key areas. We are looking at the staff attendance. We are looking at the availability of drugs. We are looking at the electricity supply. We are looking at the toilet facilities. We are looking at staff attendance. So all of these issues are what our strategy is pushing, and we are also working very hard to ensure that there is high level of compliance and the provision of basic services in the referral hospitals.
Okay. So, what is your final message to the people of this country?
Our final message to the people of this country is for us, all of us, to come together as partners in development to support the Ministry of Health and Sanitation, the government of Sierra Leone, to make our facility, most especially the referral hospitals, very, very safe.
Okay. Thank you.
Thank you very much.
What is your name, sir, and what is your position?
I'm the National Coordinator of the Hfac Coalition.
Okay. So, what are your recommendations for improvement in the health sector?
As our report indicates, we have found out that a whole lot of the health workers, especially those who are on night duties, are not actually going to their duties at night. Sometimes when they go, they do sign and leave the hospital. One of our recommendations is that those in authority, the medical superintendents at each of the referral hospital, must ensure that they themselves also come to do some night monitoring at night, so that they ensure that their health workers are actually at work at that time. And those others who are also in charge, including the sisters and the sister and whoever is in leadership of the hospitals, ensure that they are also monitoring the health workers, especially those that are in night monitoring. And the other thing also we find out is that even the distribution of drugs, we also want to ensure that we also want the government also to ensure that especially the tracer drugs, the essential drugs, are also available at night, because we want to believe that especially at referral hospitals where we have maternal, where women are giving birth, we do ensure that the drugs are there, and also that the drug stores are open for them to be accessible to those that are there. For those where the drug stores may not be accessible, we are also recommending that the drugs be given to nurses in charge, so that in the morning we will be able to account for those drugs.
Okay. And what are your follow-up mechanism now that you've launched your first night monitoring report?
As the follow-up mechanism is not very much different from all the reports that we also produce. one of the way we actually do follow-up mechanisms is to make sure that all our reports relating to our findings in hospitals are published, are actually reported to all the stakeholders in the community, as well as the donors, as well as the Ministry of Health and Sanitation, those that are in leadership of the ministry. We also ensure that some of our reports also are published in newspapers as well as in radio, so that we can galvanize public support for some actions at that facility level. The other thing also we can do is that we also go to the stakeholders of those meetings and engage them in dialogue, so that we ensure that some of those recommendations that we have actually done are being looked into and something done about it. So we do meet with the stakeholders, as well as, like for example, we also go as well with regard to the referral hospital. We go to each of the referral hospitals and have meeting with the medical superintendents and the leadership of the hospitals and give out our report to them, and we discuss with them on the issues that we have found out, so that at the end of the day we can have something done about it.
Okay, so what is your final message?
My final message actually is that we want the medical practitioners to know that they are actually in charge of saving lives at the hospital, especially at night, because actually it is at night that most people, those that are sick, actually get a lot of pain at night in their sickness. So we want also to appeal to them that whenever it is time for them to be at the hospital, let them be at the hospital and let them give all the kind of care and needed at that time, so that we can save life at that point.
Okay, thank you, sir. Health for All Coalition started night monitoring on the 21st of May 2014. At Lumley Government Hospital, there was no electricity supply and patients were using mobile phones light at the time of visit. Out of 4 staff on duty roster, only 1 nurse was on duty at the time of visit. 1 staff signed in the attendance register and left the hospital. The hospital pharmacy was closed, and a result, there was no drug supply for night patients, no water facility, no medical doctor. The nurse refused to attend to 1 male patient during his pain and bleeding. 1 free healthcare patient by the name of Memunatu Kabo of Beach Road, Lumbling, was asked to buy free healthcare drugs during our
every night doctor this. No, no night doctor.
At Kiama Road Government Hospital, there was no electricity supply also. 3 security personnel were supposed to be on duty according to the duty roster, but only 1 seen. Only 1 pharmacist was on duty for both free healthcare and cost recovery drugs. 3 nurses on duty roster, only 1 was seen at the time of visit at pediatric ward. There was no bed net available at the pediatric ward. The place was extremely hot for the children. 2 staff on duty roster for the male ward and 2 staff on duty roster for the female ward, but only 1 was seen. No medical doctor available at the time of visit. There was no water facility at the time of visit.
Ola Bello, you know the now. Marina Edward. Are you know the Marina Edward? No, so? Okay. 2 personnel, only 1 in Marina. You maybe sign in yet. No, we're going to go to the tower. Sign in now. Why you not sign it? You don't follow the for you can't do it.
Out of 13 security guards posted at the Connaught Government Hospital, 5 signed in the register, but only 2 seen at the time of visit, and it was James, one of the security men, who wrote all the names in behalf of the others. Adequate electricity supply, including standby generator at the time of visit, adequate water supply in all the wards at the time of visit. The pharmacist for the cost recovery drug was on duty at the time of visit. There were 2 medical doctors on duty, Dr. M. Ture and Dr. Falu Din. There was no sign-in register available for the urine odor was very offensive at the trauma unit. The reason was that cleaners only clean the bathrooms during the daytime, and there is only one porter in the entire hospital by the name of Fode Sankor. In Ward 4, female ward, 3 names were on the duty roster, 1 signed in, and none was seen at the time of visit. 3 nurses were on duty roster at the pediatric ward, 2 mattress for patients and their relatives. 4 names were on duty roster, 3 were present. Out of the 3 present, 1 of them wrote all the names of the others. 3 nurses were on duty roster, 2 were present, but only 1, Lucia Kosia, signed in, but she was not available at the time of visit. At PCMH Cottage Government Hospital, there was light and inadequate water supply in the wards. Drugstore for free health care patients entirely closed at the time of visit. Ward 3 was having 4 staff on duty roster, but 1 seen, while 4 on duty roster, but 2 see at Ward 4. Stock out of essential free health care drugs at the time of visit. There was 2 doctors on duty, Dr. Peter Samuel and Dr. David Davis, at time of visit. 8 staff was on duty roster, but 5 were on duty at emergency ward. There were 6 staff on duty roster, 4 present at step down ward 2, 2 free health care patients, Hawa Campbell of Grafton Town, New Site, and Zainab Conte of 18 Palmer Street, Wellington, were asked to pay for drugs and gloves at the time of visit.
Drugs available to Nananet?
Yes, sir.
At any time, eh? Yes. Why you visit? Where did you start?
What's your name?
Clarissa.
Clarissa Taylor, eh?
Yes,
At Oladorin Hospital, 6 staffs were on duty roster in the emergency and trauma unit, but only 4 were on duty that night. In the special baby care unit, 5 staffs were on duty roster, 3 staff were physically seen. 1 staff did not report for duty among the 4 staffs that were on duty roster that night. No electricity supply at the intensive care unit, and 1 child died during the time of visit. 2 caregivers and their children were accommodated in 1 small bed at the intensive care unit, Ward 3. Inadequate water supply in all wards visited. Toilet facility was very poor and produced bad odor.
Let we make salon, let we build salon, let we let salon, cause no place, no time, no place, no place, no place.